A life-threatening injury is any injury that compromises the patient's ABCs. In other words, the patient's airway, breathing, or circulation has been compromised. A life-threatening injury can also occur if the patient sustains a head injury or has a bleeding injury that will not stop bleeding for longer than 5 minutes. Your job as a lifeguard is to determine if your patient has sustained a life-threatening injury or illness. Any compromise to the airway, breathing, circulation, or a head injury, it's time to call 911. A seizure is an electrical misfiring in the patient's brain, causing them to have involuntary muscle spasms. Those spasms can be small or large, as you see in this example. Most times, a seizure patient doesn't know where they are or what they're doing, so your job as a lifeguard is to move everything out of the way that could hurt them or you. You should also place a towel under the head to protect the patient from the concrete. Once the seizure has subsided, roll your patient into Haynes position in case they need to vomit. At this point, monitor levels of consciousness. If they do regain consciousness, inform them as to what just happened, because they will most likely not remember. A seizure in the water can be dangerous for both patient and lifeguard. You need to do 2 things only with a patient in the water. Keep your rescue tube between them and you at all times, and keep their head above water at all costs. Once the seizure stops, put your patient on your rescue tube while maintaining an open airway, and then continue your emergency action plan by calling for a backboard and lifeguard assistance.
Lifeguard, I just got stung by something. I don't know what to do.
Because a lifeguard normally works outside, insect stings are commonplace for your job. After gaining consent to work on your conscious patient and applying your gloves, your next job is to remove the stinger, clean the wound, and then dress it. To remove the stinger, use a simple credit card. Press down and away from the stinger so that you do not break it off into the patient, which could release more venom. Clean the wound with water and alcohol pads provided from the first aid kit. Your kit might also include anti-sting swipes. Once the wound is clean, place a bandage over the infected area and use a cold pack to reduce swelling. Controlling bleeding is simple. You want to stop your patient from bleeding as soon as possible. In order to do that, you need to first wear gloves to protect yourself, and then apply direct pressure right over the wounded area. If the blood soaks through your first pad, apply a second pad directly on top of the first one. Do not take the original pad off, because it may open up new wounds. Call 911 if the bleeding has not stopped after 5 minutes, or if the bleeding is squirting, which means it's from an artery.
Oh, wait. Well, looks like you could be having a better day.
You think?
Sir, I'm a lifeguard. I'm here to help. You got some bleeding here, sir. I'm going to go ahead and control your bleeding.
What about my finger on the
Sir,
ground?
it's more important we get your finger to stop bleeding before we take care of that finger on the ground.
I'm gonna want that back.
We got it. Looks like the bleeding stopped. Let's get to that finger.
When dealing with an amputated body part, you'll first want to wrap the amputation in clean, sterile gauze, and then place that part into a dry, sterile bag. A glove also works as a plastic bag if you don't have one available. Place the first bag into a second bag filled with ice. Never place the amputated body part directly on ice. The nerve endings in the body part could get killed, making reattachment impossible. Behind only scraped knees and insect stings, nosebleeds are one of the more common rescues you'll make at your pool. Notice how this lifeguard identifies himself first.
Hi, I'm a lifeguard. Can I help you? All right. What we're gonna do is get you cleaned up. Would you hold this under your nose and pinch like this? All right. We're gonna wait. See if it lasts longer than 5 minutes.
Make sure your patient leans both their head and body forward so that blood does not go back into their throat. Blood going backwards down to a patient's airway can cause both vomiting and choking. A diabetic emergency is caused by a patient's blood sugar levels being either too low or too high. Signs and symptoms include staggering, anger, pale skin color, confusion, and disorientation. A good trick to use with all conscious patients is to ask them sample questions. These questions help you ascertain what is wrong with your patient.
Sir, are you feeling okay?
I'm not feeling good. I'm dizzy and lightheaded.
Are you allergic to anything?
I'm allergic to penicillin.
Are you on any medications?
I take insulin.
Do you have any pertinent past medical history?
Yeah, I'm a diabetic.
Okay, and when was the last time you ate or drank anything?
Last night.
Okay, I'm gonna go get you something to drink. I think you have low blood sugar.
Once you've found out that your patient is in fact diabetic, offering them a little bit of sugar is usually the best course of action. This can be a soda, hard candy, or even a sugar packet sprinkled directly on their tongue. Never offer your patient diet soda or anything that does not have sugar in it. If their condition has not improved after 5 minutes, call 911.
Ma'am, I'm a lifeguard and I'm here to help. What seems to be the problem?
I fell off the swing set.
You fell off the swing set.
Yeah.
Is it your arm hurts real bad?
Yeah.
Can you point to the part where it hurts the most? Okay.
When dealing with sprains and broken bones, keeping your patient's injured area stable and comfortable is your #1 objective. Using any soft item, like a towel, to create a soft splint is an effective way to immobilize your patient's injured area until EMS arrives. Notice how this lifeguard wraps the dressings both above and below the broken part of the arm. When tying off your bandage, place your finger down and reverse the direction of the dressings. Place the dressing through the loop you've created and pull, but do not cut off circulation. Examples of other splints include rigid splints, where you splint the broken bone to a hard object, anatomical splints, where you splint the broken body part to another body part, and a sling. But again, immobilizing your patient and keeping them comfortable is your #1 goal. While waiting with your patient, remember to fill out incident reports. Fill out a major incident report if 911 was called, and a minor incident report if you did not need to call 911. Because you work with shock, chlorine pucks, and acid, a lifeguard is the most likely victim of a chemical burn. If a dry chemical comes in contact with your skin, brush it off with a clean towel, always brushing down and away from your face and eyes. Once the chemicals are off your skin, rinse the infected area for 10 to 15 minutes using clean water. Never put your arm into the swimming pool. The chemicals on your arm could react with the chemicals already in the pool. If you are a victim of a wet chemical burn, rinse the infected area for 10 to 15 minutes. Notice this lifeguard got acid into her eye, so she rinses away from her other eye so that the acid does not seep into the uninfected area. Impaled objects can be as large as tree branches, but can also be as small as a tiny splinter. No matter the size, the objective is the same: stabilize and do not remove. The patient's first inclination will be to take the object out, but remember, if it cuts going in, it will also cut coming out, causing further damage. Instead, take two soft objects, like these rolls of gauze, and start to make a figure 8 wrapping around the object. This will help stabilize the object in the patient. The next step is for the patient to go to the hospital so that they can receive advanced medical care. You most likely called 911, however, some patients may refuse to go in the ambulance and have a friend drive them to the hospital. In this case, you need to have them fill out an ambulance waiver form, waiving any liability in case they do not go to the hospital.